Financial Editor with Becker's Parkview here at HFMA, and I'm here with Mike Browning. He's the CFO of Parkview Health in Fort Wayne, Indiana. Mike, thanks for sitting down with us. We really appreciate your time.
You're welcome.
You mentioned that at Parkview that you've been trying to implement some lean procedures. Can you talk about that? I know lean's very trendy and hip right now, but it sounds like it's working for you guys. Can you talk about how it is?
Yeah, we took it on many years ago, as many organizations such as the organization Wisconsin, John Toussaint was part of, and many of those. So Parkview was an early adopter of lean, and it's part of the culture, and that we have a group that manages the process. But you hope all the department leaders have that process mentality to where they're trying to make improvements on a daily basis. Some of the core concepts of lean don't always pull cost out of the system; they pull waste out of the system. Right. And so
make it a more efficient process.
Exactly, but we also have to take that and pull cost out of the system. Right. That we can take the waste out and reallocate resources and do those to a certain point. But I think you have to take the lean concepts another step or two and make sure that cost gets removed from the system. And that's where organizations will be successful. But it's part of our culture today. I think most people live by it. They see a process that needs to be improved, so they'll engage a lean team to help them. So I think they look at that as a resource to be able to help them become better. But it's really, and I missed the presentation on Sunday night, but it is really a good to great scenario, is we have to take what we do well today and we have to make it great if we're going to be successful.
What do you think, from all your years of experience, do you think the healthcare system will look like 10 years out?
We try to plan for 5, so 10
right.
is a stretch, but we had a good discussion on this about a week ago with our executive leadership team, and one of the core components we believe is, we talked about quality and we talked about service. Those I think will continue to strive for that perfection, that they will still be here in 10 years, as well as financial performance. That we have to have good, strong financial performance as a not-for-profit health system to support the quality and service initiatives that we have. So in 10 years, you're going to hear us still talking about improving quality, improving service, and having good, strong financial performance. Where I think the difference will be is that organizations today there's really that separation between hospitals and physicians, although they're becoming closer together. And there is still a separation between payers and providers. And I think in 10 years from now, you may not know the difference.
Right.
You'll see a Parkview health system that may be the payer, the provider, and managing all the care of the patient. Absolutely. And I think those organizations, because today when the patient looks at Parkview, they think we do a lot of the things we don't do that's really provided by somebody else. There may be a physician there providing service. They think it's a Parkview physician, and it's not. Right. I think in 10 years from now it will be. That you'll see those organizations have to be everything to everybody, from wellness all the way through hospice. Right. And that we'll have to be able to provide all that care through it, and then managing the risk of that patient or the episode of care.
Right. It also sounds like definitely the health of the population as well, preventing them from even coming to you guys in the first place.
Absolutely, and that's where the value comes in. Right. If we can keep them out of the hospital, keep them away from having to have diagnostic tests or
go see their primary care physician.
Absolutely. The medical home is a key component. We're looking at population health management as being a core competency of what we have to be good at if we're going to be successful down the road. And all those 10 years from now will just be something we do, whereas today that's those initiatives. It's a great time to be in healthcare, because you're going to see a change between now and probably the next 5 years, and I think 5 years from there it'll be different. So it's a good time to be part of that, because you're part of when it's getting started.
Right. Well, Mike, thanks so much for sitting down with us. We
Thank
really
you.
appreciate you coming by.
Appreciate it.